The Consortium for Resilient Gulf Communities aims to assess and address the human dimensions of the Deepwater Horizon oil spill, in particular looking at public health, economic and social well-being of Gulf Coast communities. Some example questions are: what are the direct impacts of the Deepwater Horizon oil spill on Gulf fisheries? How is the current mental and behavioural health of Gulf Coast residents related to their recalled exposure to oil spill impacts and their perceived impacts of the oil spill? We're also looking at how we can facilitate the rapid uptake of all the resources that are already available and the new information that we're generating in a way that real-world decision makers can easily access and use the information using artificial intelligence methods to make that match. We're also looking at how we can advance the resilience research and practice to help communities be more forward-looking in their analysis of the problem and their development of adaptive solutions in the event that another major oil spill occurs. We are doing an integrated research and outreach approach. We use mixed methods, qualitative and quantitative methods, and we organize our activities around 4 core functions. So I'll just briefly run through those. The first is to support stakeholders, because there's a lot of information around that they could use but perhaps they're not aware of or don't know how to access and use. We secondly have the function of responding to stakeholder needs, because we've found that communities and stakeholders, decision makers, really do need help in clarifying the problem and the goals they have and the solutions and the strategies to get to the solutions to their challenges. The third function is to generate information, and that's more what you'd consider the bread and butter of research communities. So we're generating data, doing a lot of analyses, peer-reviewed papers, etc. But we're also generating a lot of derivative products, so 2-page fact sheets, information or infographics, synthesis documents, and so on. And then the final function we have is to be critical, because communities need an evidence-based approach to understanding what works and what doesn't work, and we see that as an important part of our consortium's approach. The consortium's analyses are ongoing, but our early results have been very interesting. One from the economics team is that the short-run negative impacts of the Deepwater Horizon oil spill on fisheries was uneven across the species that we looked at. So oyster was most affected, and shrimp in fact had an increase in landings after the oil spill. We did other analyses that showed that the short-run negative impacts on landings were in fact due to changes in behaviour, so most likely related to the closure of the fisheries and the inability of fishers to go out and catch their fish that they're interested in. On the health side, we have found that the current mental and behavioural status or functioning of Gulf Coast communities is related to the perceived impacts and the recalled exposure on the communities or the residents that we've assessed. We've also found that even 5 years after the oil spill, there's worry about ongoing impacts. So people are still worried about impacts from the Deepwater Horizon oil spill on their own health or their family's health, their household economics, and the social well-being of their communities. So this will tell us a lot more about the human side of the system, especially in natural and renewable resource-dependent communities who depend on the resources from the other aspects of the system they're in that others are studying in terms of the physical, chemical, or biological processes. So we'll be able to fill out the picture a lot more. And then hopefully that'll tell us where there are most vulnerable populations, what the pathways or trajectories are to recovery, and help to tailor interventions or the distribution of resources to help those who really most need help at the time. We have developed an amazing partnership of multiple disciplines within the consortium. So we're hoping to maintain that infrastructure and continue to build on the many emergent questions and methods that are being developed from this unique combination. We have political scientists, sociologists, public health, psychiatric epidemiologists, computer scientists, ecologists, decision scientists. There's a really diverse array of disciplines. But because our research program is integrated very closely with the outreach activities, we have amazing partnerships being developed between the researchers and the community members, both through community health workers, so at a lay level, through to leaders, community leaders, and other manager or director types in government and non-government agencies. So we're hoping to maintain those relationships because they really inform both our methods and our understanding, interpretation of the findings.